Every year, hundreds of Americans pack their bags and hop on flights to Thailand, but they're not heading to Phuket's sandy beaches or to the glittering temples of Bangkok. Instead, they're making their way to one of Thailand's many upscale hospitals that cater to foreigners. What motivates them to travel halfway around the world to see a doctor? Costs. Medical treatment in Thailand is generally a fraction of what it costs in the United States.
The cost of treatment is quite maybe 1/2 or 1/3 if compared to the United States or compared to Japan.
So does cheap medical care mean substandard medical care? My mom wanted to find out for herself, so on a recent visit to Thailand, she made an appointment for a physical at a Thai hospital. There are a number of hospitals in Thailand that cater to overseas patients. Vejthani Hospital in Bangkok is one of them. Like many Thai hospitals, Vejthani offers an extensive menu of services. You can get anything from a hip replacement to cosmetic surgery or dental work, all under one roof. The first thing that my mom noticed was that Vejthani Hospital didn't look like a typical hospital. It was bright, colorful, and cheerful, more like a hotel than a hospital. And even the hospital rooms looked more like hotel suites. And there's a room to fit every pocketbook, from a single private room for about $75 a day, including nurse and meals, to a luxurious VIP suite that comes with a patient room and separate guest quarters for friends or family. And the price with nurse and meals? Just over $150 a day. Oh yes, and unlike hospitals in the West, Thai hospitals openly post their prices that they charge for their services. That way you'll know up front how much you'll be paying. My mom decided to have a physical checkup, so she selected the type of physical she wanted from a menu. My mom's physical checkup consisted of a thorough blood examination, urine analysis, chest x-ray, EKG, ultrasound, mammogram, and a pap smear. The equipment at the hospital appeared modern, and most of the doctors and a good portion of the nursing staff spoke English. While my mom waited between tests, she killed some time by checking her email. She had a light snack from their pastry bar, and she even got a relaxing foot massage, all included in the price. It took about 4 hours to go through all the tests, and in the end she met with a doctor who went over the test results with her. The total bill for the entire examination came to just $219, including the foot massage. A similar exam would cost 10 times as much in a U.S. hospital. One of the reasons why Thailand is so much cheaper is their labor costs. Doctors and nurses in the land of smiles make good salaries by Thai standard. Yet, despite that, they still make only a fraction of what physicians and nurses make in the West. A Thai hospital isn't for everyone. Not all insurance companies will cover the cost of procedures performed outside of the U.S. That's definitely the case with Medicare. At the same time, for many Americans without health insurance, Thailand could be a life-saving alternative. And the nice thing is, there's no waiting.
If the patient condition is healthy and ready to do the operation, we can do the operation. No waiting.
And things are looking bright for Thailand's many hospitals. As Western countries scratch their heads and wonder how they're going to provide affordable health care to an aging population, hospitals like Vejthani think that they just might have the answer.